Today we will discuss about the internal carotid artery. In the same cadaver, we will reflect the skin of the head and neck and facial region. We will also reflect the sternocleidomastoid muscles and superficial fascia, investing layer of deep cervical fascia as well as platysma. Here you can see there is a anterior triangle, and inside the anterior triangle this is the carotid triangle, and this carotid triangle which is formed by the anteriorly and inferiorly by the anterior belly of the superior belly of the omoid. This is the superior belly of the omoid. This one is the posteriorly and inferiorly it is bounded by the posterior belly of the digastric, and superiorly by the posteriorly and superiorly bounded by the posterior belly of digastric along with its styloid muscles. So today we will discuss about the internal carotid artery, and we will reflect the sternocleidomastoid muscles. Once we will reflect the sternocleidomastoid muscles, here you can see this is a internal carotid artery. Once we reflect the uh, superficial fascia, platysma and investing layer of deep cervical fascia, you can see this is a interjugular vein. This is the common carotid, and this one is the external carotid and internal carotid. Along with its, there is a vagus nerve. So all this structure which is lies inside the carotid sheath, we already dissected the carotid sheath. That's why you cannot see the carotid sheath, and this is the portion of the ansa cervical, but we will not right now discussing the ansa cervicalis. So this common carotid which is divided at the upper border of the thyroid cartilage into the external carotid and internal carotid. Normally, this internal carotid have a four part: cervical part, petrous part, cavernous part, and cerebral part. But inside the cervical neck region or cervical region, it does not give any branches uh, inside the neck, and which is initially there is a beginning of the internal carotid. Also, it is the level of the C3 and C4 or the upper border of thyroid cartilage. Initially, there is dilatation. It is called the carotid sinus, and it is also called the baroreceptor. We already discussed have a four part: cervical part, then it is called the petrous part, then it is called the cavernous part, and then it is called the cervical part. Inside the neck or cervical part, it does not give any branches, and initially there is a dilatation. It is called the carotid sinus, and it is the control the baroreceptor. At the bifurcation of the common carotid between the external carotid and internal carotid, there is a carotid body. It is the chemoreceptor. Now we will discuss the internal carotid artery. Initially it is superficial. When it goes inside the infratemporal fossa, it is the deep. So here it is only covered by the sternocleidomastoid muscles as well as the which is covered by the skin, superficial fascia, investing layer of deep cervical fascia and platysma muscles. But once it passes inside the digastric triangle, it is deep to the posterior belly of digastric, it is deep to the stylohyoid, and also the muscle attached to the styloid apparatus. This is the styloid process, and styloid process gives the attachment of the stylohyoid. Another muscle, it is the styloglossus. Another muscle, it is the stylopharyngeus. This is the three muscles, and along with this stylopharyngeus, there is a nerve. It is called the glossopharyngeal nerve. This is the glossopharyngeal nerve. So this stylopharyngeus and glossopharyngeal nerve, which is passes between the gap between the above there is a superior constrictor and below by the middle constrictor, and in this gap this stylopharyngeus which is enter inside the pharynx along with the glossopharyngeal nerve. So here the intercarotid artery which is very deep to this muscle attached to the styloid apparatus, and also there is a one ligament, stylohyoid ligament, which is this is the stylohyoid ligament, and it is also deep to the ramus of the mandible, also deep to the medial pterygoid, deep to the lateral pterygoid. All these muscles which is light superficial, all these muscles which is light superficial to the internal carotid artery. After that, here you can see this carotid artery reach here. You can see this one is the internal carotid artery. This one is the internal carotid artery. And this internal carotid artery at the base of the skull it reach, then it run down and forward. And again, here you can see this internal carotid artery which enter, here you can see this enter through the, it does not enter but it lodges inside the foramen lacerum, and then it enter inside the carotid canal. So here I will show you, it come at the petrous part of temporal bone through the, it lodges inside the foramen lacerum, then come forward and it enter inside the carotid canal. So this is the carotid canal, and through this carotid canal it is enter inside the skull. This is a foramen lacerum and this is a carotid canal. It enter inside the uh, through the carotid canal, it enter inside the interior of the cranium, and then this is the cavernous sinus which is lies at this part, or either side of the pituitary fossa. There is a situation of the cavernous sinus. This internal carotid artery enter inside the carotid sinus, and then here it this internal carotid artery, come out, and it is called the cerebral part. This cerebral part, it gives the many branches. Here just below to the this is the optic chiasma. This artery which is goes medially and between the this uh, cleft between the two cerebral hemisphere, and this is the anterior cerebral artery which is enter, or the middle cerebral artery, which is the another branch of the internal carotid artery, which is goes inside, and it is the branch, it is goes inside the lateral sulcus between the temporal and frontal lobe, and this is the middle cerebral artery which is lies inside the, here you can see this is the middle cerebral artery. It is the branch of the another larger branch of the internal carotid artery. One is the ophthalmic artery which is enter inside the orbit, and it supplies to the orbit, and one is the artery which is goes on the back side, and it is called the posterior communicating. It is communicated with the posterior cerebral artery. It is a branch of basilar artery, so it communicated with the posterior cerebral artery. It is a posterior communicating branch. So the cerebral part of the internal carotid artery gives the main four branches, ophthalmic branches for the orbit, and one is the anterior cerebral which is goes between the two cerebral hemispheres, and which is enter between it and above to the corpus callosum. It is run on the medial surface of the cerebral hemisphere. Another artery which is the middle cerebral, which is passes through the lateral sulcus between the temporal lobe and frontal lobes, and the fourth one is the posterior communicating, which is communicated with the posterior cerebral artery branch of the basilar artery which is formed by the two side of the vertebral artery at the pons, over the pons. So this is about to the cerebral part. The another part, it is the petrous part, cervical part. It does not give any branches of the internal carotid artery. Petrous part gives the two branches, keratotympanic branch and pterygoid branch. Cavernous part, inside the cavernous sinus, here it gives the cavernous branches, and it also gives the superior and inferior hypophyseal artery supplies to the hypophysis cerebri. So this is about to the internal carotid artery. Normally this siphon, S shape of the siphon, here you can see this is goes upwards, here you can see this is the upwards, then it goes downside. Here you can see there is a C shape of the initial, you can see C shape, this is the upside, then it downside, then on the medial aspect, then it again goes upside, and it makes the S shape siphon, and this prevent the more the heart have expelled to the blood minimum 10 to 15 feet of the height of the to pumps the blood, but this C shape of S shape of the siphon which reduce the pressure inside the brain and prevent the rupture of the small vessels of the brain by the S-shaped siphon of the internal carotid artery. So internal carotid artery, hope you enjoy the lectures. Have a 4-part cervical part, it has a petrous part, it has a cavernous part and cerebral part. Cervical part does not give branches. Petrous part gives the 2 branches. It is the caroticotympanic branches and pterygoid branches. Cavernous part gives the cavernous branches and superior and inferior hypophyseal branches, and cerebral part gives the 4 branches we already discussed inside the brain: anterior cerebral, middle cerebral, posterior communicating and ophthalmic branch of the internal carotid artery. So this one is the internal carotid artery, and both the internal carotid artery which makes the on the base of the brain, it makes the circle of Willis. It is the best example of the artery to artery anastomosis. Hope you enjoy the lecture of the internal carotid artery.